afternoon, and thank you for tuning in to your Daily News. As some of you may know, here at the Daily News, we have a segment where we like to talk about communicable diseases that infect our population. I'm going to be joined by a few guests today that are here to talk about a sexually transmitted infection known as gonorrhea. To start off this segment, I am joined by infectious disease expert and medical physician, Dr. Danny Jacob. Dr. Jacob, thank you for joining us today.
It's great to be here.
So let's start off small. Can you tell me what gonorrhea is?
Of course. Well, as you know, gonorrhea is a sexually transmitted infection caused by the bacteria called Neisseria gonorrhea. Most gonococcal infections are uncomplicated lower urogenital tract infections of the urethra or the cervix. It can be transmitted through oral, genital, or anal sex. If left untreated, it can spread from mother to baby during childbirth, which can cause blindness, joint infection, and life-threatening blood infections.
So based on what you said, it obviously affects both men and women. Does it lead to different causes or symptoms?
Yes, they do. In men, the disease can lead to the development of epididymitis, which is a painful inflammation of the tubes that are attached to the testes and can lead to infertility if left untreated. They also experience burning while urinating and also burning or itching at the opening of the penis, and the yellow or white discharge will come from the penis. In women, untreated gonorrhea can lead to pelvic inflammatory disease, which can lead to infertility in women while increasing the risk of ectopic or tubal pregnancy. Women actually experience no symptoms until 2 to 7 days after the infection. If the symptoms do occur, they will also experience burning while urinating and discharge, as well as pain in the lower abdomen and pain during sex.
So it definitely leads to some very serious complications. If someone experiences any of these symptoms, what can they expect from the diagnostic process?
There is a urine test done for urogenital gonorrhea and a nucleic acid amplification for urethra, endocervical, or vaginal infection. Professionals can also perform a culture, which requires a swabbing of the urethra or the cervix.
And in terms of treatment or prevention, what can be done?
Treatment is always antibiotics, so there are two types, ceftriaxone and azithromycin. And for prevention, primary prevention is key, such as safe sex practice, talking to your partner about your past with STIs, getting tested if needed, and if they come back positive, informing any other partner of your diagnosis.
And my final question to you, Dr. Jacob, what are we doing about the infection now?
So reported cases of gonorrhea have increased by 81% over the past 10 years due to unprotected sex. However, we have been able to increase detection rates due to an improving in lab testings and screenings, and we offer dual therapy due to an increase in antibiotic resistance.
Amazing. Thank you so much for sitting down with us today. We really appreciate you sharing your knowledge about gonorrhea with us.
It's been my pleasure.
All right, everyone, we will be back with world-renowned epidemiologists, Dr. Emma Grant and Dr. Megan Anderson. They'll be sitting down to talk to us more about gonorrhea and how it affects us and the world when we come back, and stay with us. All right, everyone, and we're back. Unfortunately, they couldn't be here with us today, but coming to us live from Sweden, Drs. Emma Grant and Megan Anderson. Thanks for joining us, ladies.
No worries.
Thanks for having us.
So earlier we were joined by infectious disease expert Dr. Danny Jacob, and he told us all about gonorrhea and how it affects our health. What I want to know from the two of you is more about how it affects the world. So, what is the reason this infection exists, and what areas of the world are affected the most?
Well, the reason it persists is due to increased antibiotic resistance and continued unsafe sexual practices. Gonorrhea is the most antibacterial resistant of all STIs, and there are concerns about having untreatable gonococcal infections. Gonorrhea is actually the second most common STI worldwide, and there is often a co-infection of chlamydia detected in 10 to 40% of people with gonorrhea.
Adding to what Dr. Grant has already said, there are 11 million cases in the Americas alone. Between 2008 and 2017, the rates of gonorrhea in Canada have increased by 109%, and in 2017, there was approximately 29,000 cases, 2/3 of which were male.
Wow, so it really is a major issue, especially with the lack of monitoring. What's the global impact?
There are 78 million new infections annually, with the greatest impact being on women and neonates in low and middle income countries. Gonococcus has also been deemed as a superbug, and there is no single reliable treatment for gonorrhea.
And of course, there's a disproportionate burden of disease in low and middle income countries and other economically and socially disadvantaged populations. Another important factor is that the most impacted group is people aged 20 to 24 due to the high rates of unsafe sex.
Interesting. Is there a reason for that?
Actually, yes. The standard for diagnostics are cultures and nucleic acid identification test, syndromic care is the reality in most lower economically advanced countries, which complicates disease reporting, documentation of antimicrobial resistance trends, and treatment failures.
It also increases the spread of HIV. South African trends show that there was a 5 times increased risk of HIV development in those with gonorrhea, and has a greater rate of tubal factor infertility of 85%, whereas the rest of the world is a rate of 35%. And in Nepal, women who have gonorrhea while pregnant have a 5 times increased risk of very premature birth before 32 weeks gestation.
Also, the prevalence of men and women. Worldwide, in 2016, women have a rate of 20 per 1,000 and men are 24 per 1,000. So this just further proves that the men do contract gonorrhea more than women do.
And finally, my last question before we go. What type of social and economic impact does gonorrhea have across the globe?
Well, a systematic review of treatment costs for curable STIs in low and middle income countries estimated a cost of $21.66 per case of gonorrhea infection when treating with ceftriaxone and azithromycin.
An analysis from 2005 estimated that antimicrobial resistance could contribute to up to 3 million gonorrhea treatment failures globally per year, at a conservative cost of $500 million USD per year. New predictions also think that the increased number of gonococcal infections and gonorrhea-associated HIV cases due to emerging ceftriaxone resistance over a 10-year period will cost about $378 million USD.
Amazing. Thank you so much to the both of you for being here today, and we hope to see you again soon.
Thank you for having us.
Thank you.
Well, everyone, that's our show. We want to thank all of our guests for being here, Dr. Jacob, Dr. Grant, and Dr. Anderson. And we want to thank you all for listening, and hopefully you learned something today. This has been our communicable disease segment on the Daily News. And until next time, good night.